study designs. How you can carry out research. What are the various methods of doing research? So, what are basically broad steps when you are planning to design a research? So, define the problem you intend to study. Like we studied your research question. Like you want to determine if the less sleep hours contribute to anxiety or not. So, this is your research question. Define aims and objectives of the problem. So, you want to find out, your aim is to find out whether there is any relationship between the duration of sleep a person takes and the anxiety score the next day. Then critical review of the literature. So you have to review how much work has already been done on these two factors and their relationship between among themselves. So that you do by reading the research that has already been done. So you read the research papers that people have published on this same topic. So that is called a review of the existing literature. Now state the hypothesis of your research. So null hypothesis is of no difference, and alternate hypothesis, yes, there is a significant difference in the anxiety scores of the people with less sleep as compared to the people who have adequate or more sleep. Okay, so that is your alternate hypothesis. Generally, if a research has already been done by previous researchers and something has already been established robustly, and if you are planning to repeat the same research study, so that doesn't do any good to the existing literature or to the world. So most of the time the research should be novel. What new you are adding to the existing literature? So always plan a research which adds something new to the existing things. So next step is define population under study, like in what age group, in what type of people you want to undertake this study. You want to take it among children or among adults, among elderly, any gender specificity, male or female, or some occupation group. So you have to specify which is your target population and specify the nature of the study. You're going to follow up the people for how long, or you're going to retrospectively see the people with anxiety, what is their sleeping patterns. So you need to determine the nature of the study. Okay, how are you going to conduct this research? So let us see what all types of study designs are there. So these are epidemiological studies. So what do you mean by epidemiological studies? So epidemiological study, if we break this term epi, it means among, demo means people, and logy means study. So it is the study of things among people, relationships or any characteristic that you are trying to study among people. So various epidemiological studies. So now there are broadly two categories: non-experimental or observational studies and experimental or interventional studies. So broadly here no intervention is given. You only observe from a distance how what is happening among your study subjects. And here in experimental study you add some intervention, you do something and then you see the effect of the intervention. So these are simple observational studies without any intervention, and these are interventional studies or experimental studies also called. So the observational studies, so let's first in detail the observational studies. They are broadly classified into two groups: population based and individual based. Population based means when you are studying population as a whole, you are determining, you are analyzing population parameters. Like you are determining the crude death rate of Jaipur versus death rate of Delhi. So these are population parameters. And other is individual based studies. You are determining individual parameters. Anxiety score of individuals in group A and versus anxiety scores of individuals in the group B. So individual based. So under population based studies, we have descriptive study like health survey, like we have we say infant mortality rate of India is this, infant mortality rate of USA is this, infant mortality rate of Australia is this. So these are health survey data. Then ecological studies, when you try to find out relationship between parameters at population level, like the consumption of dietary fibers in kgs per day in a city X, dietary fiber consumption per day, you have this data and you want to correlate it with the cancer incidence, colonic cancer incidence in that city. So these are population level data and you are trying to find out any relation. Okay, you find out that the city X, as the dietary fiber consumption decreases with years, the cancer incidence has been increasing with years. So this is an ecological study where the parameter being used is at the population level, mass level. Okay. Now, these studies, these population based studies, the inference which we get from them, they are at population level. They cannot be applied on the individual level. So, this is one fallacy that happens, especially in ecological study. It is called ecological fallacy because the results are at the population level. They cannot be applied to individual level. So, these are of lesser value when we compare different epidemiological studies. Now coming on to individual based studies. So these are descriptive studies. Examples are case reports and case series. Case report is when some let us say a pediatrician and he encounters a rare case or case which has not been documented in any literature. So he describes the case and the treatment he gave, the symptoms the patient presented with, and he describes those in his terms through a written document. So that is a case report. And case series is when patients of similar disease or similar presentation, many such cases of similar presentation come to a clinician or a doctor and those are documented in words. So these are case series. So case reports and case series. Now coming on to, so these are descriptive studies, just pure description of what has been happening to the patient, how the patient presented, the history of the patient, the present condition of the patient, then what all treatment was given, then based on the responses the treatment gave, how treatment was changed, what all drugs were added and removed. So this is just description of what happened. So this is a descriptive study. So analytical study, there are of three types: cross-sectional, case control and cohort study. Coming on to cross-sectional study, they can also come under descriptive study designs because it's like at a cross section of a population, we see it's like a snapshot of the population or the study group, and we see what is the prevalence of certain characteristic under study or certain disease. Like at one point of time, we want to see how many people have depression. So prevalence of depression at one point of time. So that is cross-sectional study or prevalence study because it helps in finding out the prevalence. So it can be descriptive, it is describing the population. Okay, at one point of time, this much males have 10% depression and this much females have 8% depression. So descriptive study. It can be descriptive study. And when it comes to analytical study, when cross-sectional study comes under analytical study, it tries to find out the association between exposure and an outcome. So then two prevalences like smoking and lung cancer. At one point of time, these many people are smoking and this many people have lung cancer. So you want to see the prevalence of two factors. So basically, descriptive studies, these help in generating the hypothesis ki okay, such and such disease has happened, lung cancer has happened, and among this much people, and they were smoking, and that led to lung cancer. So hypothesis is generated that maybe smoking could have led to lung cancer. Then analytical study, they help in testing of the hypothesis. Okay, so next is case control study. So case control study is a retrospective study. Here we start with cases of the disease and controls. These are matched in, let us suppose we have depression cases, the cases who have depression, and controls similar age group people. Let us say we have taken the people who have been diagnosed with depression in the age group, and they are in the age group of 20 to 30 years of age, and we have taken people who do not have depression but they are also in the 20 to 30 years of age group, and all females we have taken. And so we go retrospectively and find out whether they have been exposed to the risk factor which we are trying to study. Let us say any childhood trauma. So we want to see how many people under this group were exposed to the risk factor and study which is childhood trauma, and how many people in the control group were also exposed to the childhood trauma. So case control studies are retrospective studies. We go back into the history of the two groups in order to find out if any association is there with the risk factor or just the factor under study or not. Then the third type of study is the cohort study. This is a longitudinal type of a study where we follow up. We start with exposure. Two groups, one is exposed to the risk factor or the factor under study, and the other is not exposed. And we want to see whether with time they develop the disease or not develop the disease. Similarly, in the other group, whether they develop the disease or not develop the disease. So this is a follow-up study. And then we find out the association, measure of association.